So, as the UN Secretary General has said, this is the biggest test that the United Nations has faced since its founding. This is the biggest test of this generation. We are in many ways looking at a triple crisis. We're looking at a global pandemic, at a health emergency that requires an integrated, coordinated, immediate health response. We're looking at the poor and the vulnerable around the world having increased vulnerability and challenges because of the public health measures. And we're looking at the impact of the health emergency on the economy in countries, which is the third challenge. This is unprecedented. This is something the world hasn't seen at this scale, a situation where high-income and low-income countries are struggling with the same situation, competing for the same commodities. At this point in time, a key priority is to open up humanitarian corridors, open up supply chains to make sure that we can transport goods and personnel. That's key for saving lives. Another key priority, as the Secretary General has called for, is to put fighting in lockdown, calling for a global ceasefire, calling for countries, nations, communities coming together to save lives. It is clear that this crisis is having social and economic impacts that go beyond the health crisis, and therefore the efforts around the world is to understand who are the ones who are most impacted, who are the ones who are really being left behind, whether it's day laborers, whether it's people working in sectors of the economy which suffer the most from the lockdown, whether it's people who are outside of social protection programs. In terms of the forward look, I think no one has the crystal ball. We don't know what the post-Corona-19 world will look like. But what I think we know is that we need to come out of it wiser as humanity. We need to build societies that are more inclusive. We need to build economies that are more resilient. We need to build health systems that can actually deal with and face pandemics. And we need to take climate change seriously. The research is obviously not done yet, but I think everything points to a post-COVID world where which needs to be more equal, more inclusive, and more climate smart. The UN has worked with the government to prepare a multi-sectoral action plan, which is supporting the government's preparedness and response plan. This plan is building on international guidance and good practice, in particular lessons learned from the Ebola response, and is looking at 3 pillars which are health-focused, and of course led by WHO. Those are surveillance and lab support, contract tracing and screening, case management, and infection prevention control. Then there is a pillar on risk communication and community engagement. As you've seen from recent statements by the Secretary General, we're also very worried about misinformation. Misinformation actually puts lives at risk. So making sure people are aware of how they can protect themselves, but also making sure there's no unnecessary panic. There is a pillar on logistics and supplies, which is one of the big challenges globally, as I mentioned in my earlier answer. And then looking at issues around social cohesion and just the various impacts that the public health measures may have. All of this work is happening with the government, in support of the government's action. For a crisis like this, we come in to support. So the health is the core of it. Then you have the second piece of it, which is focusing on the immediate emergency needs that come out and around a health emergency, and this is what you're seeing around the world. It starts off with the health response, which is the most important thing to get off the ground, but then comes the measures that needs to be taken to protect the vulnerable and the poor, making sure no one is left behind. And that includes looking into food and nutrition security. It includes measures to look at agriculture, making sure that there's not a lost harvest, making sure there's not post-harvest loss, making sure that the next harvest is not lost. And then you have the piece on social protection. Bangladesh has a fairly extensive system of social protection, which is good, but this crisis has put new people at risk who might not be part of the existing social protection program. So we need to look at who are the vulnerables who now need support. And then looking at the fact that you have a big group of people in Bangladesh who actually work within the informal sector, and how do we make sure that micro-enterprises, small enterprises, day laborers, people working in the informal sector can also be taken care of during this crisis. And then you have the last piece, which is the whole Build Back Better agenda, Recover Better agenda. So this is the analysis around the impact of the crisis. This is the analysis and the projections on how this will influence the economy. Bangladesh has a very open economy, relying on global supply chains. Bangladesh economy is part of a global economy, and planning for that is going to be key. As the UN, we very much welcome the fact that the government has taken immediate action in terms of the impact on the poor and the vulnerable. We hope to be helpful in looking at how are these programs targeted, are there people who are left behind, can we provide support to that? But again, we welcome the fact that immediate measures were taken. We also welcome the fact that there has been early on stabilization packages put in place in terms of the economic and cushioning the economic impact, trying to maintain the very impressive growth trajectory of Bangladesh. Around the world, this is obviously the biggest challenge. This is a shock to the global economy. This is a shock to national economies, and managing that is going to be critical. Globally at the moment, and it's it's the question of global learning. You see countries taking different approaches to reopening the economy. I don't think these approaches can be the same around the world. They need to be highly localized, but they need to be mindful of lessons learned elsewhere to minimize the risk of disease spread and lives being lost.